Bill, I wanted to come to you and let's talk about the mission of the United Way and how it fits into this partnership that you're doing right now with Intermountain and others.
Yeah, thank you. Our United Way is really focused on two things. The first is we connect people in Utah to the very resources that Mikkel just described that they need. So through the 211 infrastructure, which is a nationwide use of the phone number 211 to connect people to resources, we operate that in partnership with others in our state. And so as they were standing up the Alliance for the Determinants of Health, it became clear that being able to efficiently connect people to those resources, knowing what those resources are, having a database of the 10,000 different resources in Utah that people might access, that's important to this process. The other thing that has become clear over time is that it's not simply a technical challenge of passing information from a healthcare provider to a social service provider. There's a human challenge to help that transfer of information result in a better outcome for the patient. And so we've been involved in that process, doing something we call a coordination center, which is coordinating between the providers and the community-based organizations to make sure people get where they need to go. The second thing, and maybe the larger challenge, is related to our mission to build partnerships that solve problems at scale. So for the last 10 years, we've been focused on transforming the educational environment for Utah kids. The health environment is something that's very much related to that. Much as there are social determinants of health, there are social determinants of educational achievement, and they're very much related. And so we've been focused on that for 10 years, building partnerships across sectors with health systems and businesses and community organizations and governments and schools to try to make sure that the education environment produces the best possible result for every child. And this work fits very nicely into that. It's an extension of the work that we've been doing to bring people together, figure out what the objectives of collaborative work are, and then to work on those in a unified, aligned, data-driven way.
Yeah, it's amazing how many touch points there are. We'd love to think that it's just a matter of getting the information around, but it really is inserting the right people, the right partnerships. I mean, this partnership brings together an awful lot of organizations. It's not just the United Way and Intermountain, is it, Bill?
No, not at all. In fact, it's important to know of Intermountain's catalytic leadership role and their embrace of the idea that we have to work collectively, that the systems that we're trying to align and integrate really are operated by many different organizations, and they and we have invited all of those systems and organizations to the table so that we can co-create a solution that works for everybody.